Joining me is to discuss it more is Dr. Amesh Adalja, an infectious disease expert with Johns Hopkins Center for Health Security. Welcome, and thanks for being here.
Thanks for having me.
So what is this and what makes it different?
Well, this is another version of the Omicron variants of COVID that we've been dealing with for years and years now. And what makes it different is this one seems to be a different branch of the Omicron family tree. And that means it might be a little bit difficult for our immune systems to recognize it as well as we recognize other forms of SARS-CoV-2. And that may be a challenge for updating the vaccines, but there's no evidence that this is causing any more severe disease or causing any wave at this time. It's just something that we're tracking and will be important to follow.
How prevalent is it right now? Are you seeing it fairly widespread across the country?
No, there's not really been that much of an uptick in it. If you look at the sequencing data of how many of the viruses that we're sequencing, it's less than 0.5%, although it has been detected in the wastewater of maybe half of the states. And in certain countries like Germany, the Netherlands, Denmark, it does account for about 30% of cases, but it hasn't been spreading very much yet. It's not the dominant variant in the United States, but you have to remember that these variants are always going to change, and there's always going to be one that's dominant and then another one that replaces it in perpetuity.
Yeah, it's just how these things work, right? So you said that the symptoms, they're going to be about the same, almost feel like you have the flu?
Exactly. They're all going to be the same COVID symptoms that we've been dealing with now for 6 years. They're all on that spectrum. Some of them might have a little, more sore throat in this one versus the other one, but in general, it's the same spectrum of illness.
Things have changed so much through the years. What is your thought about getting tested and knowing what you're dealing with? Do you feel like it's really important if you have some of these symptoms, especially with a fever, that you find out what it is and then treat accordingly?
Definitely, because all of these respiratory viral infections overlap. Influenza, COVID, RSV, and there's different pathways. So we have different antivirals for COVID, different antivirals for influenza, and it's easier than ever to test for these. There are now home tests for influenza, for COVID, and for RSV, so people can know what's making them sick and get on the right treatment pathway very quickly now in a way that they couldn't do prior to the pandemic.
Yeah, it's about as easy as it can get, and I guess the same old thing, don't be near someone sick, wash our hands as well as we can, just the same prevention measures.
Yes, exactly. The same thing. If you're high risk, make sure you're up to date on vaccines. If you're high risk, ask for an antiviral, cover your mouth, stay away from people. If you're sick, wash your hands a lot. All of those apply. While
we have you here, I just wanted to ask you about Mpox because I keep seeing headlines about that. What are your thoughts about that, and how is that looking right now, especially in the U.S.?
So Mpox has still continued to infect people in the United States. It's kind of a trickle, not like those big numbers that we saw several years ago. What's interesting, though, is there's another clade of Mpox called clade 1B that is somewhat more dangerous, more severe, and there have been about 15 cases of those in the United States, all either travel-related or directly related to someone who traveled. But the thing about Mpox is that we have a vaccine, but not enough of the high-risk population has been vaccinated. And remember, Mpox is traveling in sexual networks in the United States, so it's really important for those individuals to get the 2-dose Jynneos vaccine so that they're protected against this, because the threat of Mpox hasn't gone away, even if it's not in the headlines that much anymore.
All right. Well, thank you so much for taking time to walk us through this. Always nice to get your expertise.
Thanks for having me.